You're listening to Parent MD, the podcast where top pediatric experts do the homework for you, sharing clear and trustworthy medical advice so parents feel empowered to take the very best care of their kids.
Welcome to Parent MD. I'm here with Dr. Eric Storch today talking about COVID and its impact on the mental health of children and adolescents. So welcome, Dr. Storch.
Well, thank you. It's great to be here.
Will you tell us a little bit about your background before we start talking about our topic for today?
Yeah, sure. So I'm a clinical psychologist, and I've been practicing both clinically, but especially in research domains and educational efforts for over 20 years now.
And what does your research focus on mainly?
So primarily kids with OCD, kids with anxiety, and then a whole bunch of other kind of topics thrown in there.
And it's in that world of OCD and anxiety that we've gotten to overlap our clinical practices some. And so I'm really excited that you're here to talk with us today. Of course, many people are discussing COVID and its ongoing impact on children and adolescents. I think it's really on our minds right now as kids are entering back into school. Some of them have already started, some of them are getting ready to. And I just want us to talk a little bit about what we've seen over the past year and thinking about going into the school year too, what kids might be experiencing. But talk to me a little bit about what you've seen in your clinical practice and maybe even research about how COVID might be impacting kids' mental health.
It's been a hard time for everyone.
Yeah.
Ranging from being isolated to not being able to engage in the things that you enjoy to the overall stress of the pandemic. I mean, it's just been a hard go.
Yeah.
Now, I think those who have pre-existing mental health problems, in this case, OCD or anxiety, have really struggled. And they've struggled for a few reasons. One is when you think of OCD, when you think of anxiety among kids and adults, one of the core features is this intolerance of uncertainty.
Right.
And of course, that's what we're dealing with right now.
Had a large dose of it.
Massive amount.
Yeah.
And so this has really been a huge factor for individuals. And what we've seen is that for those with OCD, symptoms have generally gotten worse. Right. For those engaged in treatment with OCD, the trajectory of improvement that we would ordinarily expect has really been a bit attenuated.
Okay.
They haven't done as well as we would think they would or predicted they would. Now, another thing we've seen is a number of new cases of anxiety or OCD that probably wouldn't have presented otherwise. And typically those scenarios, we're seeing folks who have these concerns about contracting COVID or contracting it and then giving it to someone else as kind of the two primary domains.
Okay.
And then, of course, just the stress that's on. So all this together has really made for a tricky kind of clinical presentation and a common scenario where symptoms have either gotten worse or had new onset.
And it's kind of difficult sometimes thinking about treatment with OCD, right? And some of the things that we might do to treat more contamination-based OCD, which is the domain that we would think about right with COVID. How are you working with kids? Because historically, we would have done things like don't wash your hands and, go handshake with all these people. And like right now, that's considered problematic for a lot of people in this world. So are you doing things differently with treatment? Or are you doing treatment as usual?
So there's a little bit of precedence for this.
Okay.
So back when the HIV epidemic came about, there was a little bit of information that guided us here. So people really didn't know what this was, where it was coming, how it was contracted.
Right.
And so you ended up seeing this kind of, reaction where people were avoiding things or doing things very differently, even though it wasn't really necessary to do in that space.
Right.
Now, kind of the idea that we take here is really the local norms, the local laws, and putting those in effect. So in the case of exposure therapy, what we never do in any case, pandemic or otherwise, is expose people to extraordinary risk of harm happening. Now, on any given day, that risk is a certain level. Now, the pandemic's just sort of raised in a different way. So, for example, as you pointed out, we don't go around, shaking hands with people, or interacting in close spaces or other types of things. And so how that's informed and how we shift practice is just being considerate of what kind of public health guidelines are dictating. And so I think that's allowed us to continue to provide high fidelity treatment. But at the same time, the stress on top of all this, I think, is what's sort of, being a little bit of an anchor in the way we're providing care or the effectiveness of that care.
Well, I think too, what a lot of family saw, particularly at the beginning of the pandemic, when we didn't have quite as much information about this particular COVID-19 too, was how it was transmitted. So a lot of concern about surfaces, more so then than maybe what we think about now. And so you saw a lot on social media about people wiping, groceries down and kind of doing things that would be considered concerning. And people really taking extraordinary steps to ensure that COVID-19 wasn't coming into their homes. And so, how do you know when that's OCD in a kid too, versus like what we were doing to take care of our families, right, in the beginning, or just like being a kid in a pandemic and dealing with all this uncertainty and information?
The first thing is it's not always crystal clear. And we just have to acknowledge that sometimes we'll get it right, sometimes a little bit wrong.
Yeah.
And I think that wiping down boxes is a perfect example. It was absolutely reasonable at the onset when we were trying to understand. But if we saw it now, we would call that excessive. And I think that term sort of informs us of when we want to be more concerned. So when the behavior is above and beyond what's being recommended, I'm not talking a little bit above. We're really, like a standard deviation, like a healthy step above. And so when that's happening, or when the behavior has to be performed, or else there's an incredible amount of distress, an inability to resist it, that's when I start worrying about it crossing the line of someone who's just maybe a bit more conscientious to this being a more problematic presentation.
Yeah, really consuming time away from things that they really might enjoy, getting in the way of like family functioning or activities, all those kind of things. I'm just curious too, it's not uncommon in, kids with OCD to have some depression too, right? Because it takes away so much in their life with functioning. But are you seeing more levels? Are you seeing increased levels of depression in these kids or other kids that you're seeing?
We are.
Yeah.
It's a great observation, and I think in part it's what you nailed. That this is hard stuff. This is taking up time. It's uncomfortable to be distressed so much. There's this other piece though too, where folks aren't as easily able to engage in the activities that brought life meaning and satisfaction, especially at the beginning when athletes were missing out on their senior season of a sport, or couldn't go to prom, or weren't. Homeschooling was a relative nightmare for a lot of folks and their parents. So I think a lot of these things really, brought a lot of kind of loss to individuals and compounded, pre-existing OCD or anxiety presentations.
Yeah, it's been hard to hear kids talk about these like moments that I have back in my, in my memory about high school graduation and all those kind of things. And they just did not get to have those same experiences. So it's just been such a year of losses for them. One thing that, we've noticed as well, so we have people with OCD, right? We have people with other forms of anxiety, and those with social anxiety actually seem to do a little bit better in the pandemic with some of the isolation. But now that kids are going back to school, that's probably not going to be the case. So what should parents think about with their kids who are socially anxious? How might they prepare them as they go back to school? And they have to be around more people, because I will say from my own experience, right, after you're isolated and you weren't around as many people, the first few times I was around more people when things relaxed, it felt like an odd experience. And I'm not a socially anxious person. So take someone who does have that social anxiety, it's going to feel a bit jarring, I think. And people might want to get them ready for those experiences.
Yeah, you're right. I gave my first talk in person, and usually I get going quick. And it was not so smooth at the beginning. One of the best ways to do it is to start practicing. And so if you have D-Day of a certain date for school or an activity, start building up towards that. So it could be practicing walking the halls, doing drop off, starting to do a particular project, presenting in front of the family, presenting in front of friends, calling up other kids that you have a relationship with to schedule a play date or get together or whatever. But I think those kind of, get the rust off. In therapy, we'd call those exposures. But I think that's one of the approaches for trying to deal with having to re-enter the world.
More adolescents have panic disorder as compared to kiddos. Do you foresee issues with, kids wearing masks at school, those kind of things, who have panic disorder? Do you foresee that leading to them feeling breathless, any kind of thing? Have you seen any of that in your clinical experience, anything like that parents should be concerned about?
Yeah, I actually haven't seen that.
Yeah.
And in fact, we've with the mask piece, for most kids, they're sort of just like, all right, this is what I have to do.
Yeah.
And I think they follow kind of, the school's lead, and and kids will be kids, but I think they generally are able to function effectively in that space.
So it doesn't really seem to trigger those anxious feelings, because I think there was some concern about that, but we also have not seen that as a clinical target or concern for our families either. What about just other anxiety domains? We've talked about social anxiety. We've talked a little bit about OCD. What about our kids with generalized anxiety? What are you seeing for them in the clinic, in the world of COVID? Because they also, uncertainty is the bane of their existence.
Yes, it is. I think they've struggled a lot.
Yeah.
We published a paper where we looked at the trajectory of treatment in individuals, kids, and adults with OCD. And then we have one we're about to submit among kids and adults with anxiety. And what we're seeing is kind of similar. Their trajectory improvement has not been as sharp. When there's certain factors that are brought into play, like a family illness, financial uncertainty, these are also factors that are really getting in their way. I think you hit it with that aspect of uncertainty kind of being a core feature here. But there's so much challenge with school. There's not the same ability to engage in activities, especially if kids remain online. I think there's the fear of contracting COVID, and especially with variants coming out. So all these things have made it a really difficult period, the last year and a half for this group.
Yeah, I even think about these kids as they re-enter school, and there will be those stressors there for them around the uncertainty with COVID and just re-entry in school. And maybe I didn't, their academic year was probably pretty different last year, and maybe what they learned and kind of getting back into the groove of that, right, with maybe their experiences that they have. And we know those kids with anxiety can even look like they have ADHD. And so I'm just imagining them like trying to, deal with the uncertainty and what that might even impact with their executive functioning and just things, that parents might see, but just giving them a little space to transition and get going in the school year. The great news is our teachers, they'll have those relationships and contacts with the teachers too, to have their eyes on them like they have historically and help identify what's going on in the classroom. I think it'll just even be an adjustment for all kids to go back to what's it like to be in a classroom and do academic work the way it used to be, because I think last year it was pretty different for most kids. And even being away from their family, I'm wondering if particularly some of our younger kids are going to have some separation anxiety now actually going to school with having been maybe with their parents or other family members a lot during the day. What are your thoughts about that?
Yeah, I think it's going to be a tough adjustment for those little ones. And a tough adjustment being able to focus for so long in a setting. On the other hand, some of the children who really did well in homeschool because there was more efficiency. They could work at their pace. I think returning to school can be difficult because you're now sort of going at the group pace. And ultimately, it kind of comes down to this individualized response to a transition. I think on the positive is that kids are pretty resilient. And so as long as we give them clear messages, confident, optimistic, hopeful messages, they're really going to come through. And we have some good resources for those that struggle. Yeah. I think, frankly, more than ever.
Yeah. So let's talk about some of those like confident, optimistic things that parents can do in toolkits that we've done around anxiety, OCD. We talk about reassurance, which can be problematic in an anxious kid, right? To tell them over and over that things will be okay. But we also do want to give them the message that they're capable of doing things. So what might parents, say to these kiddos that might be a little anxious going into these school days? What would be some messages that you think could be helpful for them?
I think one is, you got this.
Yeah.
You did this before. Nothing's changed. You're older. You're more capable. Let's look at our past experiences. Hey, let's look at these other kids. They can do this. If they can do this, you can totally do this. And then breaking things down to small steps. And of course, practicing beforehand, but just saying, hey, we don't have to focus on a week from now or 2 weeks, just today. And I think some of those messages can be helpful. You hit it on reassurance. We want to be careful about that, but a little bit of, hey, like it's going to be okay once in a while can be helpful.
I really love the practicing too. I mean, as adults, it's helpful, right? Too. You were talking about the presentation, we're getting back in front of people and talking. It's new. Maybe I should have practiced before I did my first one because, a little rusty. And so I think those steps can be so helpful. And, just like you said, going and driving by the school and being around other kids and having some of those pieces, just practicing those steps, just making it a little bit easier on that first week and those manageable steps. I really like that. And then I think about we really like the idea of them getting going in school and getting them started. But sometimes after a few weeks of school, if they're still struggling, like what do you think about in terms of parents like seeking treatment? What are signs to you like that things might be time to maybe talk to someone like you who's a psychologist or a therapist to see if maybe something more needs to be done?
I think when we see that persistence of anxiety, where it's not something that that's going away in a couple days, couple weeks, but sticking around and getting in the way, so that interference and distress aspects tend to be two of the main ones there.
Mm-hmm.
A lot of times, though, especially with the young ones, we may not see a massive amount of interference, but we may see things like tummy aches or headaches or clinginess, regression in behavior. So as parents, we just want to be on the lookout for this. Now, not only do we have some good treatments that can help, but we also want to be aggressive in trying to just sort things out. Now, some of the work that we've been doing is how can we actually teach parents to be effective in providing care for their kids. Okay. So at times it doesn't even involve having to have kids come in. Like we developed a program that had the very innovative name, Coping with COVID. but we taught parents in 6 sessions a whole bunch of skills that they could use for their anxious kids. And in that short period of time, we had about 3/4 of them describe things being much improved compared to when they started, and really saw some large effects in terms of improvement in anxiety and stress among their kids without ever having seen the kids.
Yeah, and there's more models coming out about that, right? Particularly in the anxiety world, that some shifts with the parents and how they might address some things can make substantial changes for the child, which, I mean, it might be easier than to get the parents, there and not have to get another human there, their child. It just makes it more accessible. I think one of the things that I worry about from the pandemic is just accessibility of treatment in general. It's always been an issue for kids, but now in the world of COVID, finance is changing for some families, the accessibility. Plus, we know that, data showing us that depression and anxiety has about doubled in our child and adolescent population. So are there enough providers out there who are going to be able to address needs? So if we can have innovations like this, where we have parents who can do things and go and find education where maybe they don't have to come and see someone, but make those shifts before it gets to that point, I think that's really important, because there were already too few providers, unfortunately, before the pandemic. And we're seeing it in children and adolescents. Not surprisingly, we're seeing it in adults too, because we've all been sitting through this for a while. The other group of kids that I was actually really thinking about too is those who've lost a parent or a grandparent or a family member during COVID to COVID-19, and the anxiety that they experience having actually lost someone. Have you been working with them clinically? Certainly there can be trauma effects, those kind of things. So just curious about, working with children who've seen the loss of a loved one from COVID-19.
Yeah, we have seen a number of those kids, and it really is difficult, especially because the way it came about, that there was potential to have some impact on this and prevent this outcome. Yeah. I think for others, they couldn't say goodbye in a way that they may have otherwise been able to. And this often happened with grandparents who are sick in the hospital, especially at the beginning when there's such a lack of clarity about this condition. So there are a number of kids, a number of adults as well, who are struggling, with this grief secondary to loss.
Do you see that kids are starting to worry about their own mortality in a different way if they've lost a loved one to COVID-19? Like that they're worried that they may die more easily then? Like, does that get caught up in their anxiety or OCD? I don't know if you've seen that or not.
Yeah, we've seen it a lot I'll say, I guess, two things. In our generally anxious kids, we've seen that factor in. This could happen to me. I could catch it. I'm really worried about this. Within our kids with OCD, many of whom are anxious, we've seen that. We've also seen this concern that maybe I have it and I'm asymptomatic, and I could go and somehow give it to someone that I love or someone I don't even know, but it falls on me. So that inflated sense of responsibility and that potential of harming others, of course, I don't want to. I think those have been a couple themes in the symptomology of anxious kids.
It's interesting. I mean, it's really impacting in so many ways. The other thing I was just thinking about is, sleep too. Anxious kids tend not to sleep as well. And so just so many ways. I have done a toolkit on eating disorders. We're certainly seeing that increase substantially as well. So lots of impact. What I hope we can leave parents with, though, is that with good treatment, kids get better. And you brought up resiliency before. And I mean, that's part of why I love working with kids, right? They tend to be resilient and they can get better. Everybody can get better. But I mean, kids really have this, if you get them into the right treatment, right? This real ability to rebound and have good outcomes. So I think that we can share that message of hope, no matter what the diagnosis is, that, yep, there's probably going to be ongoing uncertainty that we face through this fall and winter. I think there will be some good coming from the routine of school and being in person, right? Being back with classmates and having clearer routines, hopefully, although not totally known. And then helping kids manage through that uncertainty, but then getting them treatment if they're starting to demonstrate signs like academic decline, not sleeping, not eating in their normal patterns, not participating in things that bring them joy. Any last messages that you want to leave for parents as we wrap up today? I've enjoyed talking to you as always.
Well, likewise. I think, echoing what you said of be aggressive in getting treatment. You have to be persistent, which is one of the challenges. So you may go up one route and it just doesn't pan out, but keep kind of looking to advocate for your kids. I think, to quote my father-in-law, who has a saying, big kids, little kids, little problems, big kids, big problems. We don't want these kind of problems to become bigger and bigger. And they do as the anxiety tends to go untreated. And so we want to be mindful of that piece. And again, there are great resources in addition to treatments. So just make sure to kind of pursue those in an aggressive fashion.
The one other thing that just popped in my head, because it's something that I talk about with parents a lot, is them taking care of themselves too. Helps them help their children, which has been hard, right, during the pandemic to do all the self-care that's needed. But hopefully them being able to prioritize some of the time for themselves too, to, if they're having anxiety or whatnot too, to get their own treatment as well, or, just to exercise or whatever it is that they need to do for themselves as parents. It's hard, but it's also good modeling for our kiddos. So,
indeed.
Well, I've enjoyed having you here today. I want to thank you for being involved in some toolkits for us for Parent MD. You've helped us with OCD. You've helped us with parents looking at research, which has been fantastic. So we hope to have you back to do some more with Parent MD, and love everyone to come visit our website and go to our social media.
Sounds good. Thanks so much for having me.
You've been listening to Parent MD, the podcast where top pediatric experts do the homework for you, sharing clear and trustworthy medical advice so parents feel empowered to take the very best care of their kids. If you enjoyed today's episode, go ahead and click on that follow button on your favorite podcast app. It's the best way to make sure you never miss a single episode. And while you're at it, why not leave a 5-star rating and comment as well? We'd love to hear your feedback, and it helps other parents find the show. The Parent MD podcast is a part of Parent MD, a new way for pediatricians to help parents. Parent MD is an online source of parent information you can trust, straight from board-certified pediatricians. For more information about Parent MD, visit us at our website, www.parentmd.com. That's it for this episode, but we will be back soon to tackle another topic to help parents make confident and informed decisions about their children's health.